So if you look at these various types of childhood cancers, what are the typical challenges that you see that affect the outcomes for the
If you
patient?
open a textbook of pediatric oncology, what it will teach you is that when you treat children with cancer, the vast majority of children get cured. And I think that is the first message over here. 80 to 90% children get cured across the board, with some cancers doing better and some cancers doing worse. And again, going back to a textbook version, what they would say is that some children, 1%, 2%, 3% may have very severe side effects needing intensive care and ultimately may succumb to their illness and the treatment.
Hmm.
And another 5 to 10% would have a relapse or recurrence. And so those are the two main challenges which a doctor and a healthcare community and the patient should be aware of and deal with. However, this textbook version applies only to 10% of the world,
Hmm.
because in the rest 90% of the world, there is this additional dimension of accessing care, abandoning treatment, not finishing treatment. And depending on where you live and what kind of hospital you access, this may be anywhere from 0.5% in Germany to as high as 80 to 90% in parts of Africa.
Hmm.
And so this is the real world. And so all pediatric oncologists and stakeholders in this area have to accept it, have to understand it, and have to find ways to deal with it. Because without dealing with how a child reaches your hospital, how a child gets the treatment, how a
Right.
child makes through the treatment, and then goes on to become a survivor or needs palliation or needs both, all that has to be within this umbrella of access to care. And that is what is relevant for this children's outcome.
Right. Right.